1. Which of the following instruments is primarily used for scaling supragingival calculus? A. B. Sickle scaler. C. D. Excavator. 2. The primary role of a dental dam during restorative procedures is to A. Reduce gingival inflammation. B. Isolate the operative field. C. Enhance aesthetics. D. Improve occlusion. 3. Which dental radiograph is most effective in detecting interproximal caries? A. B. C. Bite wing. D. Panoramic. 4. A positive tuberculin skin test indicates A. Current active tuberculosis. Past exposure to tuberculosis. C. Negative immune response. D. Immunity against tuberculosis. 5. Which dental cement is most commonly used for permanent cementation of crowns and bridges? A. Zinc oxide enamel. B. Glass ionomer cement. C. Zinc phosphate cement. D. Calcium hydroxide. 6. In four-handed dentistry, the transfer zone is located A. Directly in front of the patient. B. Over the patient's chest area. C. Near the dentist's side. D. Behind the dental assistant. 7. Which of the following is considered the most critical factor for sterilization by autoclave? A. Pressure. B. Time. C. Steam. D. Temperature. 8. The correct sequence in the dental hygiene process of care is A. Assessment, planning, evaluation, implementation, diagnosis. B. Assessment, diagnosis, planning, implementation, evaluation. C. Planning, assessment, implementation, evaluation, diagnosis. D. Diagnosis, assessment, implementation, planning, evaluation. 9. Which of the following materials releases fluoride and provides chemical adhesion to tooth structure? A. Composite resin. B. Glass ionomer cement. C. D. Zinc oxyugonal. 10. In infection control, the purpose of utility gloves is to A. Prevent patient cross-infection. B. Provide better tactile sensitivity. C. Protect staff during instrument processing. D. Replace examination gloves. 11. The most common site for oral cancer is A. Floor of the mouth. B. Hard palate. C. Buccal mucosa. D. Gingiva. 12. Which handpiece is used with a prophy cup during coronal polishing? A. High speed. B. Slow speed. C. Ultrasonic scaler. D. Laser handpiece. 13. What is the recommended fluoride concentration in community water supplies in Canada? A. 1 ppm. B. 0.7 ppm. C. 5 ppm. D. 2.0 ppm. 14. The role of the circulating assistant includes A. Passing instruments directly to the dentist. B. Maintaining the operating field with suction. C. Monitoring patient comfort and providing supplies. D. Placing dental dams. 15. Which of the following is a symptom of irreversible pulpitis? A. Mild sensitivity to cold. B. Sharp, lingering pain to thermal stimuli. C. No response to percussion. D. Complete absence of sensation. 16. When loading an anesthetic syringe, the bevel of the needle should face A. Away from bone, toward bone, C. Toward soft tissue, D. Away from soft tissue. 17. Which component of amalgam provides strength and resistance to corrosion? A. Silver, B. Copper, C. Tin, D. Mercury. 18. The best method to reduce cross-contamination during radiographic procedures is A. Using disposable film holders, B. Wiping film packets with alcohol, C. Wearing double gloves, D. Using larger film sizes. 19. Which tooth surface is located closest to the lips on anterior teeth? Angual, buccal, C. D. 20. Which matrix band is most commonly used for Class 2 amalgam restorations? A. Toffelmeyer matrix, B. Sectional matrix, C. Clear matrix strip, D. Automatrix. 21. Which instrument is designed for removing decay from tooth structure? A. Scaler, B. Excavator, C. Condenser, D. Carver. 22. When assisting in crown and bridge procedures, retraction cord is placed to A. Reduce tooth sensitivity, B. Control bleeding and widen sulcus, C. Improve shade selection. Isolate saliva. 23. Which of the following is a sign of anaphylaxis? Localized redness, B. Mild swelling, C. Difficulty breathing, D. Tooth pain. 24. The periodontal probe is used to measure A. Pocket depth, B. Carious lesions, C. Mobility, D. Crown length. 25. Which disinfectant is recommended for cleaning blood spills in the dental office? A. Wipes, B. C. 1:10 dilution of sodium hypochlorite, D. Quaternary ammonium compounds. 26. What is the correct sequence of donning PPE? A. Gown, mask, gloves, eyewear, B. Mask, gown, gloves, eyewear, C. Gown, mask, eyewear, gloves, D. Gloves, mask, gown, eyewear. 27. Which of the following is used to detect subgingival calculus deposits? A. Explorer 1112, B. Periodontal probe, C. Sickle scaler, D. Condenser. 28. The main purpose of the evacuation system is to A. Increase water spray, B. Maintain clear visibility and reduce aerosols, C. Replace dental dam usage, D. Deliver anesthetic. 29. Which of the following is a key sign of acute necrotizing ulcerative gingivitis, ANUG? A. Pink firm gingiva, B. Punched out papillae with gray pseudomembrane, C. Receded gingiva with no inflammation, D. Overgrowth of gingiva. 30. Which classification of motion should dental assistants strive to minimize? A. Class 1, B. Class 2, C. Class 3, D. Class 4. 31. Which tooth numbering system uses a 2-digit code with quadrants numbered 1 to 4? Universal system, B. Palmer notation. C. D. Jigmundy system. 32. What is the most appropriate action if a sterilized instrument pack is found to be torn before use? A. Use it immediately. B. Wipe with disinfectant and use. C. Re-sterilize the instruments. D. Discard the instruments. 33. The primary function of fluoride varnish is to A. Seal pits and fissures. B. Strengthen enamel and prevent caries. C. Improve tooth color. D. Reduce sensitivity permanently. 34. Which of the following best describes a Class 3 malocclusion? A. Mandible is retruded relative to maxilla. B. Mandible is protruded relative to maxilla. C. Normal occlusion with crowding. D. Open bite present. 35. Which of the following materials is most often used as a cavity liner due to its ability to stimulate reparative dentin? A. Glass ionomer. B. Calcium hydroxide. C. Zinc phosphate. D. Composite resin. 36. Which instrument is primarily used to smooth and shape amalgam after condensation? A. Burnisher. B. Carver. C. Condenser. D. Excavator. 37. What is the main purpose of a periodontal dressing after surgery? A. Provide aesthetics. B. Control plaque formation. C. Protect the surgical site and aid healing. D. Replace sutures.